You're listening to Oral Surgery Insights. I'm Dr. Russ Lieblick, and sharing his expertise with me today is my partner, Dr. Brandon Rehrer. Brandon, today we're discussing a topic that truly shows how much we can change things for the better with comprehensive dental care: full mouth reconstruction.
It's a significant topic, Russ. We see patients who have been dealing with extensive dental issues for years, and they often feel like their situation is hopelessly complex. Our entire approach is built around taking that complexity and creating a clear, manageable, and most importantly, a safe and positive path back to health for them.
That is the absolute key. Often, patients reach a tipping point where they're tired of temporary fixes that don't last, or they're struggling with the discomfort and inconvenience of a removable denture. They are looking for a definitive long-term solution, and that's what full mouth reconstruction provides.
And that's our expertise. Not just providing the solution, but ensuring the path to get there is as clear and comfortable as possible. What we do goes far beyond simply replacing teeth. It means restoring the proper ability to chew and speak, recreating a natural look, and rebuilding a patient's confidence and comfort.
Seeing that change in a person is powerful. We had a patient who had endured years of increasing dental issues to the point where she was extremely self-conscious. Starting a full mouth reconstruction plan with her was a big undertaking, but watching someone rediscover their smile and confidence after treatment is finished, it's a clear sign of what's achievable.
Those journeys require a lot of commitment from both the patient and our clinical team. But the outcomes, when everything is carefully planned and carried out, can be quite extraordinary. Full mouth reconstruction offers that path forward when multiple areas of the mouth need thorough, coordinated attention.
For our listeners, understanding what full mouth reconstruction really means is important. This isn't one single procedure. Instead, it's a highly customized series of treatments planned to address extensive dental needs across the entire mouth. We're essentially performing a complete overhaul of the patient's oral health and function.
A good way to think of it might be like working with a high-end architect and general contractor to renovate a home. You share your vision, and they handle all the complex blueprints, permits, and subcontractors to deliver your dream home. You get the final result without having to manage all the intricate steps yourself. Similarly, in the mouth, we're addressing everything from the foundation of the jawbone to the final appearance of the teeth.
The process often kicks off with a very thorough diagnostic phase. Surgically, we might need to perform necessary extractions to remove teeth that are too damaged to save. Dealing with any existing problems first, like cysts or infections, is also a key first step to create a healthy base to build upon.
After that, bone grafting often plays a vital part. Many patients who need this level of care have lost bone in their jaw where teeth have been missing for a while. For dental implants to be successful for the long haul, they need a solid platform of healthy bone. Grafting procedures are designed to rebuild this missing bone.
And dental implants themselves are very often the main building blocks of a full mouth reconstruction, especially when many teeth are missing. These titanium posts act like artificial tooth roots, providing an exceptionally stable and lasting base for the final replacement teeth.
The flexibility of implants allows for different solutions, from replacing one missing tooth to supporting a bridge for several teeth, to providing anchorage for full arch restorations, sometimes using designs like the all-on-4 or all-on-X techniques that can dramatically bring back normal function and appearance.
It's a highly adaptable technology. We adjust the number and placement of implants based on the patient's specific anatomy, how much bone they have, and the type of final teeth planned. The goal is always to achieve the best support, stability, and lifespan for the new teeth.
A vital part of making this process feel simple for the patient is the close teamwork between the oral surgeon and the restorative dentist or prosthodontist. This truly is a team effort, requiring careful coordination between the surgical and prosthetic steps.
This is so important. Patients shouldn't have to feel like they are a messenger between different dental offices. We have very close collaborative relationships with the region's best restorative dentists. We are in constant communication with them from the very beginning.
We have meetings and share digital files with their dentist throughout the process. When the patient goes from our office to their dentist for the next step, their dentist already has all the surgical information, the component specifications, and the shared prosthetic plan. There's no starting from scratch.
That continuity of care is essential for a high-quality result and a stress-free experience for the patient. Our entire surgical plan is reverse-engineered from the final smile their dentist has designed. We start with the question, where do the teeth need to be for ideal aesthetics and function? And then we, as the surgeons, build the foundation to perfectly support that result.
It continues that architect and builder relationship we mentioned earlier. As the surgeons, We are the structural engineers, ensuring the foundation and framework are flawless and built to last. The restorative dentist is then the master craftsman who creates the beautiful, final finish. The patient benefits from having dedicated specialists managing each critical phase of the project.
Technology today has greatly changed our ability to plan and carry out these complex reconstructions with more precision, which in turn simplifies the patient's experience. Digital methods are now a key part of the process.
Absolutely. It often begins with advanced 3D imaging, like a CBCT scan. This gives us an incredibly detailed view of the patient's jawbone, which lets us do careful surgical planning. With that 3D model on the computer, we can test fit, different implant sizes, and angles before surgery. We can map out a precise path that ensures the best possible bone support and avoids any sensitive areas. It removes virtually all uncertainty.
And this detailed planning is what allows the actual surgical day to be so efficient and predictable for the patient. All the complex problem solving is done by us weeks before they even arrive. When they come in for surgery, we are working from a very precise, predetermined plan.
This digital plan can also help us create a computer-guided surgical template. This guide is used during the surgery to direct the instruments to the exact pre-planned position, greatly improving accuracy and safety.
These technological steps lead to more efficient treatment, often with less surgical time, possibly less discomfort for the patient, and results we can really count on. It all comes back to simplifying the experience for the person in the chair.
The patient's journey through a full mouth reconstruction is a significant one, often involving several steps over several months. It starts with that thorough first visit to check everything and create the plan.
This initial phase is so important for creating that clear, individualized roadmap. We spend a lot of time discussing the planned steps and healing times so patients know exactly what to expect. For many full arch cases, the patient comes to our office with their failing teeth, and through a carefully coordinated surgical visit, they can leave that same day with a beautiful, fixed, temporary set of teeth attached to their new implants.
And that teeth-in-a-day concept is only possible because of the intense digital pre-planning we do. It's a complex process for us behind the scenes, but a very streamlined and impactful one for the patient.
The psychological lift for a patient in that moment is incredible. They walk in with a compromised situation they may have been hiding for years, and they walk out with a secure, aesthetic smile. They can go out to dinner that evening, albeit with a soft diet, and feel confident. This one-day transformation is a huge part of simplifying what would otherwise be a very long process with traditional methods.
After that, there's a healing period for the implants to fuse with the bone, a process called osseointegration. During this time, patients are never without functional, aesthetic teeth. Once the implants are fully healed, the restorative dentist takes over to make and place the final, permanent teeth.
Witnessing that final step, seeing the patient's reaction to their restored smile and their ability to chew well, is truly one of the most satisfying parts of what we do. It's the result of careful planning, skilled surgery, and often how incredibly well patients handle the process.
The changes in how someone feels emotionally and mentally can be just as deep as the physical changes. Giving someone back the ability to eat comfortably, speak confidently, and smile freely can have a huge positive impact on their overall quality of life and self-esteem.
So Brandon, as we wrap up our discussion today, it's clear that while the term full mouth reconstruction sounds big, the goal of a specialist team is to make the process feel manageable and clear for the patient.
Exactly. We take on the complexity through comprehensive diagnostics, meticulous digital planning, and close collaboration with our dental partners. This allows us to create a streamlined path for our patients so they can focus on the transformative outcome.
It's a testament to what modern dentistry can achieve when expertise and technology are focused on the patient experience. We hope this overview of full mouth reconstruction has been both informative and perhaps inspiring, showing what can be done for comprehensive oral restoration today. If you have questions about your own dental health, we always encourage a thorough consultation with your dental care provider to explore your options. Thank you for joining us for Oral Surgery Insights.
We appreciate you spending your time with us and trust this discussion has been valuable.
Thanks for listening.